my name is Heather Mambretti. I'm physician assistant working in rheumatology for the past 13 years. And today we'll be discussing the different educational points that I typically share with my patients when initiating Sarilumab for PMR or rheumatoid arthritis. I usually start the conversation off by talking about the goal of initiating Sarilumab, and that's typically a discussion about improving their symptom control, their quality of life, and ultimately in the setting of RA, treating to a goal of remission. And then in PMR, I discuss with the patient that if they're having difficulty tapering off steroids without flaring, or just having a difficult time reducing the burden of steroid use, that Sarilumab is the first and the only biologic that's approved for polymyalgia rheumatica. It was approved in 2023 for polymyalgia rheumatica. Sarilumab has been approved in RA for the past several years, beginning in 2017. I talked to the patients a little bit on the surface about the IL-6 pathway and why Sarilumab yields improvement so quickly in the pathogenesis process of the disease activity. I also talked to them about the fact that Sarilumab is generally fairly well tolerated, but we do have to consider risk and benefits in terms of their underlying condition, infection risks. I use the medication cautiously in patients who have a history of significant infection, and I do discuss that in detail as I'm sharing starting points with the patient. And then I give them generally the expectation that if we're using Sarilumab in the setting of rheumatoid arthritis, it may be a long-term biologic for them that we can use in addition to a typical disease-modifying medication like methotrexate or leflunomide, but that Sarilumab is in fact available for monotherapy in the setting of RA, and that's oftentimes where I use it. In the setting of polymyalgia rheumatica, when I'm talking to patients about the expectation of timeline in terms of treatment with Sarilumab, I typically tell them that it will take at least a year, possibly 18 months of using Sarilumab before we can consider whether we have the option to taper the medication. So I set that expectation up from the beginning. There's no official guideline published about when we should begin tapering Sarilumab, but the general consensus in the rheumatology community and in different settings where I've asked the question is that 12 to 18 months after we have patients in remission without any further flaring off of corticosteroids, we begin tapering Sarilumab, and everyone can use their clinical judgment in that setting. Thank you for listening, and if you have any further questions, please go to the WRAP website or download the WRAP app for more information.